You may soon get a call from your doctor, get this, over your shopping habits. Some hospitals are starting to use consumer data to identify those most likely to get sick. The goal is for doctors to reach out before there's a big health issue. So let's bring in Bloomberg News health reporter Shannon Pettypiece. She is here. Shannon, A, this sounds creepy, and B, it doesn't even sound believable, because when I actually have health problems, issues, I can't even get my doctor to call me back.
Right, you can't even get a phone call. Well, that's changing, because under Obamacare, they really want to keep you healthy now, because they now don't get paid for how many tests or services they do. They get paid by keeping you healthy. So that's part of the reason why they're so interested in this consumer data. And what they're looking at is the type of stuff that Amazon and Target and these big retailers have been looking at for years to market products to you. They're talking about things like credit card transactions, things you buy with a store loyalty card, what type of vehicle you own, do you own a motorcycle, how much did you pay for your house. All of this information hospitals are now getting. They're plugging into these complex algorithms and trying to use those details to predict who's likely to get sick, who's at risk of showing up at the emergency room, and then getting to you first to prevent that.
Who's going to get hit by a truck?
Yes.
Right? I have to say that I have a huge problem with the kind of big brother approach and people watching and it's none of their business. But I would personally give up that kind of data to my doctor at the drop of a hat because I want to be kept healthy, right? Although I'm not going to stop riding motorcycles. Can people opt out of these things?
Then hold on.
Yeah.
Then you don't actually want to be healthy because that's a death mission. just so you know.
As you may have found out yourself.
You know, exactly.
But for someone, if a doctor knew a patient, rode motorcycles and enjoyed motorcycle racing, next time they see you, they could say, man, I just want to make sure you're always wearing a helmet when you ride your bike. Motorcycle accidents, I see a lot of them in the ER. And you could say, okay, yeah, I should remember that.
But just walk me through, how is a doctor going to get compensated for making all of those, preventative calls?
So how does it work? Well, so the doctors and hospitals want to keep you healthy because now hospitals get penalized if people show up at the emergency room too often. Hospitals get penalized if they do poorly on sort of quality outcomes, if they're not managing their patients' blood pressure correctly, and they're getting penalized by Medicare, which pays for all the insurance for people over 65 and is the main payer to hospitals. So if you're someone who is coming back with your blood sugar out of control, your blood pressure out of control, if you're showing up at the emergency room because you're in diabetic shock, that's now costing hospitals money. So if a hospital can look at your spending data and say, I know this person's a diabetic, but it shows that they use their credit card at Dunkin' Donuts every morning. It shows they buy a lot of junk food at CVS, and we can track that with their credit card and their loyalty card purchases.
Okay, that is so super freaky.
We need to give this person a call. And, right, it is totally freaky, but the information is out there and being collected on us already. It's just being used for marketing rather than health care. And I should say that this is all still sort of in the very early stages.
I would hope so.
Yes, we're all still in the very early stages. If you have not been getting a call about, like, the 4 martinis you had last night yet,
I don't want them to know what I'm watching, what I'm buying, what I'm eating, where I'm going.
You wouldn't want your doctor to know that? You wouldn't want your personal GP to know that information? I mean, I don't want anyone to know that but my doctor.
I want my doctor to know it if I'm sharing said information.
Yes.
Right.
And I should say, the main hospital chain implementing this is called Carolina's Healthcare System. They're considering an opt-out mechanism where you could say, where it would address the exact situation. Matt wants that information, Stephanie doesn't. All right.
A lot of people don't tell their doctors everything.
A lot of people lie about smoking is a big one.